I am Dr. Lokesh Pandey. I am a consultant pediatrician at Bhagirathi Neotia Women and Child Care Sector. I will be talking today on a very important topic, something which is pretty common but unknown to most of us, and that is about anemia. Do we know that 70% of the kids pan-India, and this is a government record, suffers from anemia, and the cause of that anemia is iron deficiency. In spite of the fact that iron is so abundant a metal all across the world, still such a large population, and especially kids between 6 months to the adolescents, suffer from anemia. So why do they suffer? The early ones suffer primarily because late starting of complementary or semi-solid food. And the other reason could be continuing to give large amounts of milk to these children, and especially cow milk, because we all know that cow milk is deficient in iron and vitamin C. The other reasons could be that we do not know which food actually contains lots of iron. So our main stress, in spite of the fact that we give lots of amount and we plan to give good food, we do not plan our food well. So these are the primary reasons, and the main age group which actually suffers from this are the kids between 6 months and 2 years, because it is a developing phase, their growth rate is very high, so their demands are pretty high. And the other age group are the adolescents, because they grow very fast, so the requirement is very high. So what should we do? And why should we be supplementing iron or giving them iron-rich foods? The primary reason is that if they have anemia, they won't grow well. And it is not only about the physical growth, it is also about their neural development, their brain growth, their cognition. And for the bigger children, they would get very lethargic, they would be irritable, they would not have energy. So we should keep in mind that whatever food we give should be rich in iron. And what are the common foods which are rich in iron? The most common ones are the lentils, that is the dal we have, and chickpeas, the common chola, which has a very high content of iron. The other common foods are the green leafy vegetables, spinach, broccoli. Among fruits, the ones which have good iron content are watermelon, apricot, of course not commonly available, banana, apples. So we have to define our food, divide whatever food we give depending upon its constituents, especially keeping in mind that the iron content is there. But even with our best efforts, what happens is that either the child does not want to take that amount, the amount which we give is always not enough, so we need to supplement. So the Government of India recommends that all kids between 6 months to 2 years should be supplemented with iron, around 10 milligram to 20 milligram, maybe at least twice a week. And beyond 2 years, at least once a week, around 50 milligrams, and beyond 10 years, around 100 milligrams. Now, the problem with most of us is we think that iron, since it tastes bitter, the child won't tolerate, it would cause lots of vomiting, constipation, but that happens in a very small amount, very small percentage of kids. So what should we do? Talk to your doctor, get the iron supplements. You can mix them with fruit juice, because we all know that all vitamin C containing fruits, citrus fruits like orange and sweet lime, if we add this iron to that, the juice, and give it, the tastes better, and the absorption of also iron improves. So the target would be to ensure that all children from 6 months to the adolescent phase get a supplement of iron, and we need to ensure that they are given iron-rich foods regularly. Thank you.